All right, I'll just make a couple of brief remarks. Obviously, we continue to closely monitor the available data provided through the county's dashboard, and we are concerned regarding the significant increase that we've seen specific to positivity rates in Miami-Dade. In fact, the last data for Miami-Dade County registers an 8.66% positivity rate with a 14-day average of 7.59. Those numbers are of concern to us. As a result, and because the safety, well-being, and the security, the health of our students and employees is our top priority, we are reconvening the Public Health and Medical Expert Task Force, which includes notables from our community and beyond. In fact, Dr. Vivek Murthy, who is part of the transition team's advisory team to the president-elect, is part of our task force. It is our intent to reconvene them fairly swiftly, present all of the data that is available, and obtain recommendations from DUS about moving forward. So this is where we are at this point, and we will rely on the advice and recommendations from this task force to make decisions regarding the next weeks and months as we continue to observe a second surge happening across the country.
Mr. Carvalvo, does the governor ordered all schools to stay open. Does that handicap you? Does that put you in the box as far as your options moving forward?
I think it is fair to say that the best decisions regarding the safety, well-being, and health of our local communities, the decisions need to be made at the local level, well informed by medical experts, and that is our intent. Obviously, we will have conversations with entities in Tallahassee, much like we will have conversations with local health entities here locally, as well as our school board. But we need to continue to be guided by science and the data that informs our everyday decision-making process.
Has the state provided any sort of guidance, for example, similar to New York, at a certain point by which they would recommend closing schools? And if not, do you have the authority locally to make that determination?
So we continue to have conversations with Tallahassee regarding technical assistance and guidance for a phase 3 that the state, including the county, entered a number of weeks back. We have not received it yet, and no, we have not received further guidance regarding specific thresholds and the actions that would take place if those thresholds are met or exceeded. With that said, I believe the Florida Constitution provides certain guarantees and protections for decisions regarding education to be made at the local level, and I think the state is understanding of that. Miami was the epicenter of COVID for the state and for the nation for a while, and certainly the South Florida community made decisions that perhaps other parts of the state did not. We will continue to follow the best advice we can get from the public health and medical experts, and that is why we will be convening our public health and medical expert task force very soon to present them with the available data and get specific recommendations about going forward.
Would it be helpful to have a statewide policy guiding all school districts in Florida so there was less back and forth? How helpful would that be?
You know, I think statewide policy can be helpful, but can also be detrimental because the conditions are often very different across the state. That's why I continue to believe that at the local level, we are best positioned to the extent that we are informed by the health department locally, and to the extent that we have access to the best available data. I think we are best suited to make those decisions. We do not make them in a vacuum. These are informed decisions. They are collaboratively arrived at in conjunction and under the advice of experts in the area of public health and medicine, and that's exactly the way it should be.
If you have any evidence, if you have to close back down again, how will that basically reshape the rest?
We certainly hope that the closure of schools is a measure of last resort. I mean, we try to balance out the health concerns that we are faced with side by side with the deleterious effects that social isolation, mental health, and many others have on children. But ultimately, we need to be guided by medical advice and public health advice. I cannot predict at this point what decisions will be over the next few days or few weeks, but we have been anticipating as across the country this second surge, and we're seeing it. We're seeing it in urban areas, we're seeing it in suburban areas, we're seeing it in rural communities. And I think the decisions about what takes place in those communities ought to be left to the local entities in strong collaboration with medical experts.
You've had a number of cases, obviously, and schools had to shut down 2 schools. Is there any evidence that the schools themselves are spreader environments, or are cases just coming into the schools?
So very good question. So our dashboard currently reflects around 460 student and employee cases. For a system of our magnitude, with 300,000 students, close to 40,000 employees, that's a relatively small number, but not to be ignored. At this point, based on the information that we have, we cannot connect a single case to a contamination that would have taken place inside a school. The cases that are reported and the quarantining of those individuals are done based on our protocols, which are fairly strict, but we cannot trace a single infection at this point to a school site or to a workplace.
And what percentage of students are physically learning right now, going to school?
Right now, we have 45% of our student population in the schoolhouse model, learning in a presential brick and mortar model, and 55% obviously learning through My School Online.
And so you've got room for social distancing in that, and yet you still have the community spread. Are you worried that the community spread is going to become so great outside of school that it's going to impact what you have to do?
That is my biggest concern, is that social behaviors outside of the school, the lack of social distancing, the lack of wearing a mask, people relaxing their behaviors, letting down their guard, may very well pose the biggest threat to our public school system. As I said earlier, we cannot identify a single case where the contamination, the infection began at a schoolhouse or the workplace, because our protocols are pretty airtight. But we do not control the behaviors of people during the weekends, in the evenings, in restaurants, in bars, in clubs, or at the park. That is why our own viability maintaining schools open depends greatly, immensely, on the behavior of our community at large. So maintain your distance, wash your hands, wear your mask. If you have any symptoms, do not report to work. Make the appropriate contact immediately. Okay?
Can I ask you just on, not necessarily for this, but is there any concern about funding or repercussions from the state? I know based on the earlier reopening timeline, that was something that was floated out there by the state in terms of not opening on time. Are there any concerns if the school district, I know you said that's the last resort, but if the school district should have to take an action?
Yes. So look, we have a very good working relationship with the governor and with the Commissioner of Education. They have acted responsibly and reasonably in the past. They have opened exceptions for communities and parts of the state where the positivity rate has been extraordinarily high. And I believe that they would continue to look at those differences. Obviously, we will continue to have conversations with state entities, with local entities, particularly the health and the medical community. And should we be advised of steps to be taken, we will communicate those with the state and understand which actions we must take. But I think reasonableness will prevail as it has thus far. And again, I am not predicting closure of schools, but on the basis of the data that we currently have, it is absolutely prudent for us to reconvene our public health and medical expert task force and present them with all of the data and listen to their expert advice as we move forward. Look, we have Thanksgiving coming up. We know that's a natural, historic get-together for opportunity for our nation, and we need to be prepared, and that's why we are reconvening this task force.
En español.
Pregúntame.